Thank you so much for joining us tonight. My name is Laura Hager. I'm the program director here at CAPS, and I'm so excited to have our first dermatology presentation. Dr. Wetli has some fantastic information that you're going to love. First, I just want to introduce the brand new Dermatology Center at CAPS. We are so excited to be able to offer comprehensive skincare. Now you can really come to CAPS and take care of all aspects of your skin. So we are going to go over all sorts of different things tonight having to do with stress, common skin issues that can be affected by stress. But in just a moment, Dr. Wetli is going to introduce herself, but I want to let you know there is a chat button at the bottom of your screen. Please do not hesitate. Please don't hesitate to use that. I am going to just change this right here. Start the screen share again. This always gives me fits. Sneak peek of the there. There we go. There we go. You got to see the last slide first. But she's going to introduce herself and talk all about different things that can affect stress and some common issues with skin. But I also want to let you know, please, again, use that chat button. Ask any questions that you want during the presentation. I will be in the back answering as many as I can, but we're also going to have a Q&A with Dr. Wetli at the end. So anything that I don't get to, when I come back on, we'll discuss that. If there's anything that we don't get to, if we run out of time, I want to be cognizant of everyone's time frame here tonight, we will absolutely email you the answer within the next couple of days. The other fun thing is anyone who logs on tonight will automatically be entered in a raffle for a $100 CAPS Med Spa gift card. So I think we are ready to turn it over to Dr. Wetli.
Thank you so much. Hi, everyone. I am Dr. Wetli. Before we start this presentation, I thought I would give you a little bit of information about myself. So I grew up in Strongsville, Ohio, which is a suburb of Cleveland for those who may not know. I am an identical twin, and I was a competitive figure skater growing up. But I always knew I wanted to become a physician. So I attended John Carroll for my undergrad degree. I majored in biochemistry and cell molecular biology. And then I attended medical school at the Shaw School of Medicine at Wright State. After medical school, I then completed 4 additional years of residency training that was specific in dermatology. And many of you guys may ask, well, what is dermatology? All I know about dermatology is what I see on Dr. Pimple Popper. And that is one aspect of dermatology, but dermatology is a very broad field. And, we are certified in skin, hair, and nails. And along with these different types of medical conditions, we also do cosmetics like Botox, as well as skin surgeries that will remove size skin cancers, lipomas, or cysts. Another common question that I do get is, do I see children? Absolutely. I see all ages. So from little babies, infants, to teenagers, adults, and even the elderly. So with that said, let's start our presentation. And I'm just going to go over some of the most common medical conditions that I see as a dermatologist and how stress may have its role. Okay, so the first topic is psoriasis. What is psoriasis? It is a chronic inflammatory skin condition that causes these really thick, red, scaly plaques on the skin. It most commonly affects the elbows, the knees, the scalp, and the back, but it really can affect anywhere on the body. Sometimes it is very limited, as you can see in the photo here to the left, just involving the elbow. But it can be widespread and actually cover head to toe, and can be very severe and debilitating. Psoriasis can appear for the first time in children as well as adulthood. And many patients tend to have a family history of psoriasis as well. The most common condition is called plaque psoriasis or psoriasis vulgaris. And there's other different subtypes, kind of depending on the location of where it may be located. So you can have nail psoriasis, as well as palmar plantar psoriasis involving the hands and the feet. Guttate psoriasis is actually one I see a lot in children after having strep throat. Inverse psoriasis commonly affects the armpits or under the breast or even the genitals. And then psoriasis can also affect the joints, and we call this psoriatic arthritis. And we commonly see this in the hands and the feet especially. Here are some photos of psoriasis. On the left here are more common manifestations in the scalp as well as the knees. And you see they're very thick, scaly plaques. Over here on the top right is a photo of gut tape psoriasis that I tend to see more commonly in children, kind of those smaller type papules on the back. And then in the center here is inverse psoriasis, commonly affecting underneath the breast. And then here's a great example of nail psoriasis with nail pitting and oil spots, as you see. So what causes psoriasis? And there's many different factors, but pretty much we simplify it to genetics and some sort of an exposure. So we know that there are many genes involved in psoriasis. That's why it's a lot of the time these patients do have a family history. And then if they have that predisposition of getting psoriasis, there's some sort of an environmental trigger that causes it to form and to be seen. And those triggers are medication, sometimes infection, as I mentioned with kids having strep throat, and then stress, the key point of this presentation today. So psoriasis is a hyperproliferative disorder driven by an abnormal, overactive immune response. So many of the treatment options that we do have for psoriasis target the immune system to actually make it function normally. And once you have psoriasis, unfortunately, it is a chronic skin condition. And sometimes you may have some triggers or flares, but it can all well be managed. Some of the most common triggers for psoriasis flares include stress, infections, medication, smoking or alcohol consumption, skin injury, and we call this Kebnerization, meaning that there's some sort of trauma to the skin causing the psoriasis plaques to form. That's a thought why we see it commonly on the elbows and the knees, and then as well as pregnancy. So is it treatable? Yes. So as I mentioned, there's no cure for psoriasis, but there's so many highly effective treatment options available. And treatment really kind of depends on the location and the severity and type that you may have. And treatment options are pretty broad, so I'm just going to keep it pretty simple by saying that there's numerous topical medications, oral medications, and injectable biologic medications. And those are the ones that you probably see TV commercials about. All right, we're changing over to eczema. So eczema is a general term for dry, itchy, scaly rash that affects all ages and is caused by kind of a combination of 3 different factors. One thing is a skin barrier dysfunction. Sometimes patients will have dry skin due to just their normal anatomy and genetics, as well as losing a natural moisturizing factor in their skin. Another thing is an immune dysregulation, kind of like psoriasis, but on the opposite end of the spectrum of the immune overactivation. And then environmental triggers, obviously weather, temperature, and other seasonal allergies may play a role. So as I mentioned, eczema is a general term for dry, itchy skin. Us as dermatologists like to actually classify what specific eczema a patient may have. So this topic of eczema can actually be an entire Zoom presentation by itself. So I'm going to keep it pretty simple. Here are just a few of the common types of eczema that I do see. Atopic dermatitis, steatotic dermatitis, nummular, progesterone dermatitis, dyshidrotic eczema, stasis dermatitis, hand dermatitis, id reactions, and irritant and allergic contact. All right, and here's just a few of those photos of some of those examples that I just mentioned. So atopic derm, here you see this poor little baby having these patches on his cheeks. Hand dermatitis, something that we could probably all relate to, especially during these COVID times, by excessively washing our hands and frequently using hand sanitizer. Steatotic dermatitis I see commonly in the elderly, just because as we age, our skin tends to thin and we lose that natural moisturizing factor, making it more susceptible to dry, itchy skin. And then on the bottom here is one of my favorites, allergic contact dermatitis. So you see in the bottom left here, these patches involving the eyelids. Something is coming in contact with this patient, most likely due to cosmetics that is causing this itchy rash around the eyes. And then the other one adjacent to it is a common allergic contact dermatitis to nickel from the belt. All right, acne. We all know that acne can cause us stress. So acne most commonly appears on the face, the neck, chest, back, and shoulders. So there's many factors contributing to acne. And we all know it starts usually in those adolescent years, just due to the increase in hormones, oil production, and bacteria. And we know that this can be painful. There's a lot of inflammation, and it can really vary in its severity. And really kind of depending on the severity and what it looks will depend on the treatment option. And here are a few examples here. So you see on the top left are mostly comedones, or what we call whiteheads and blackheads. That's going to be treated much differently compared to these bottom two photos here with very, very severe inflammatory papules, pustules, and scarring. So these patients down here on the bottom need aggressive treatment to prevent scarring from occurring. And don't worry, don't stress. If you do have acne scars, we can treat them with a combination of medical treatments as well as the other ancillary services that we do have available here at CAPS, so our laser center, as well as our med spa. We can definitely help improve acne scarring. I do want to spend a little bit of time on the top right picture here. As you see, these acne lesions are along the jawline. This is a classic distribution for hormonal-induced acne, and something I frequently see in women in their adulthood. Okay, telogen effluvium, we're moving on to hair. So this is a disorder that is a reversible condition characterized by excessive hair shedding caused by stress. And let's learn a little bit more about telogen effluvium. Okay, so what exactly is it? It is a very common non-scarring hair loss, and that's important. Non-scarring hair loss means your hair follicles are still there, hair can still come back. And it usually occurs 3 months after a major stressor. I commonly see this after pregnancy, either some sort of illness or surgery, COVID especially, and maybe starting some new medications like new OCPs or thyroid medication, Accutane, and even some beta blockers, which will treat hypertension or high blood pressure. So what exactly is telogen effluvium? How I describe this to patients is that our hair, majority of our hair follicles are in the growth phase. We call that anagen. So as you can imagine, most of our hair is growing. There's a small percentage that is in this telogen phase, meaning to shed. So it is normal to shed about 100 to 150 hairs per day. However, when you have that major stress in your life, all of a sudden, it actually shifts our hair cycle to be prematurely pushed into that telogen phase. So more hair is actually being shed. And as I mentioned, this is an excessive hair shedding over the entire scalp, and it is temporary and does self-resolve. I always encourage patients to be seen and evaluated for any type of hair loss because there could be treatment options available to make sure that it is the right diagnosis for your hair loss. So don't stress about skin cancer. Come and get your skin checks here at CAPS with us in the dermatology department here. So a skin screening is a quick visual examination of skin to check for either melanoma or other skin cancers. I usually ask patients to put on a gown so I can thoroughly examine any moles, skin tags, or any kind of markings that may be unusual in color, size, shape, or texture. I often use my dermatoscope, and that is something right here. It does magnify certain lesions so I can get a full appreciation of what these actually look like and if it is something truly that we need to be concerned about. So the importance of skin screenings does help detect skin cancer early, and that's when it is easier to treat. So skin cancer is one of the most common malignancies that affects all ages. So the incidence is increasing annually, and it's really important for patients to understand maybe the different types of skin cancer. So we all have heard about the scary melanoma, and I will talk a little bit about that in a little bit. And we're going to ignore the cell down there on the bottom right, just because it is actually a rare type of skin cancer. But first, we're going to talk about basal cell carcinoma and squamous cell carcinoma. These top two images here are the most common skin cancers that I do see. Basal cell being number one, and then followed by squamous cell. And as you can see here in the basal cell, it kind of looks like eczema in a way. And that's why it's really, really, truly important if you have a spot that you are worried about or that is new and that is not going away, to be seen and evaluated and potentially treated. And another example here with the squamous cell, it could just look like an acne lesion that doesn't go away. So here's a few more photos of a basal cell carcinoma, kind of this pearly papule on the nose, and you see some blood vessels kind of going through it. That translucent appearance is kind of also a giveaway for a basal cell carcinoma. And then squamous cells here, kind of an eroded plaque on the scalp. That is a very common location for squamous cells. I want to spend a little bit of time on actinic keratoses here on the top right, because these are precancerous lesions. So they're not skin cancer yet, but they have the potential to eventually turn into a skin cancer. So anytime I see these actinic keratoses, I do need to treat them and prevent them from turning into a squamous cell carcinoma or another type of skin cancer. Okay, so now melanoma. It is a type of skin cancer that forms from the melanocytes. And these are the types of cells that kind of give our skin its tan or brown color, and they become abnormal and start to grow out of control. And so it is less common than the basal cells or the squamous cells, but melanoma is the one that we all fear the most because it can rapidly spread deep into the skin and then spread to our lymph nodes and potentially other organs. So there's different types of melanoma. Superficial spreading melanoma is the most common, and that's when it tends to grow on the surface of the skin before it goes deep. Lentigo maligna is a type of melanoma that I tend to see in older adults, and it's usually on very heavily sun-damaged skin. And then acral lentiginous melanoma usually is common for skin of color, and these lesions tend to occur on the hands and the feet and the nails. So it's always really important to look at your toenails and fingernails every month when you're doing your self-skin. Okay, so how do you get melanoma? Really, this should say, how do you get melanoma and other types of skin cancer? Because the main cause of skin cancer is an overexposure to sunlight or UV radiation. When you expose your skin to all of this UV radiation from either the sun or tanning beds, it causes cell damage. So who's at risk, or are there other risk factors for developing skin cancer? And those are patients who have fair skin, freckles, or a high number of moles, those who have blue or light colored eyes, those who have blonde or red hair, especially red hair, excessive sun exposure or sunburns, a history of tanning bed use, and I'll talk a little bit about that in a second, a personal or family history of skin cancer, melanoma, and a weakened immune system. So tanning beds, I really want to stress the importance of avoiding these. According to the AAD, just one indoor tanning bed session dramatically increases your risk of getting skin cancer. So it can be as high as 20% to develop melanoma, squamous cell by 67%, and basal cell carcinoma by 29%. Women who tan indoors before they turn 30 years old are 6 times more likely to get melanoma. And this is here in the AAD. If you want to see more information about the American Academy of Dermatology on melanoma or tanning indoors, you can see the link below. You can get more information if you are interested. So really, those who have any tanning exposure must get skin cancer screenings every year to make sure we catch these early. Warning signs of melanoma. So melanoma typically is most commonly seen on the legs in women, and then the chest and back for men. It can occur anywhere, but those are the 2 most common sites for genders. And then obviously any frequent or high sun exposed sites are common. But I have seen melanoma that occurs in the eyes, the mouth, the genitals, nails, and obviously spreading to other internal organs. So, most cases of melanoma actually start on normal skin rather than previous moles. So that's why it's really important to pay close attention to any changes on your skin. And a way to kind of detect different changes or to identify concerning lesions is the ABCD criteria. And so that is A for asymmetry. So does that mole kind of match the other half? B is border. We want nice, smooth, even borders. C is color. Moles that are multiple color or really dark brown or white or red are not good. Those need to be evaluated. D is diameter. So we say, is it larger than 6 millimeters, which is the size of a pencil eraser? Or E is evolution. So is it changing in size, shape, color? Is it becoming symptomatic? Those are things to kind of keep in mind. So before I go into this really quick, I do want to stress the importance of wearing sunscreen and sun avoidance, because not only does it help with anti-aging properties, it does really truly help prevent these different types of skin cancers. And then for fun, here's some other stress-induced skin conditions that have some fun photos here. So a habit, tick, nail deformity, shingles, rosacea, and prurigo nodulars.
Thank you so much, Dr. Wetli. That was so good. I know it's crazy, but I could look at those pictures all day. I think they're fascinating. That was such a great presentation. But I wanted to kind of take over real quick because the last slide here just talks about the insurance. Dermatology Center CAPS, Dr. Wetli, does accept most major medical carriers. There are just a few exceptions if you have an HMO. And how to tell with that is if you look at your insurance card, the letters HMO are actually on the card typically. So Medicaid or OSU insurance are three that we don't accept. Almost all the other ones we do, but you still want to ask your carrier. So the best way with any practice that you're going to is always to call your carrier and see if you are covered. Best surefire way to find out. But you can also give our office a call too. If that's easier, we can let you know. I am going to, if you had some great questions come in, I am going to click off the screen share. Hopefully it will work this time. There we go. And I want to go over these with you. Again, we have some great questions coming. And if we didn't get to yours, I know as I was walking out of the back, there was a few more still coming in. So if we don't get to yours, I will email you the answers. And some of these you went over during the presentation, but I could just kind of reiterate because I had a few of the same ones coming in. So at what age can patients start coming to see you?
Any age. So I see babies, I see newborns, teens, adults, elders, everyone.
Okay. Oh, this is a really good one. If I come in for a skin check, do you take off anything that day or do I reschedule and come back another time?
So that's a fantastic. So depending on what it is, if it's something that we need a biopsy, I will tend to biopsy it that day. If it is a precancer that needs treated, sometimes I do freeze those with the liquid nitrogen that you may see for kids with warts. Similar thing. But yes, if something needs to be treated or taken care of, I tend to do it on the same day.
I knew the answer to this, but how do I know if I need to be seen for my rash?
So if you are questioning it, then absolutely please call. Let's evaluate that rather to, take a look, see what's going on, and then get a treatment plan if you need it to.
Absolutely. And, I love that slide that showed the really fast skin check, but it is, I know some people are nervous to come in. They keep putting off that consultation. It's quick, it's easy, it's painless. She does such a great job. And trust me, I had way too much sun exposure before, so she has many of my little bumps and excisions. But so absolutely don't worry about it. If you come in, again, it's quick, it's easy, it's uncomplicated, it's over before you know it. So again, that video really is how it works. But I had a skin cancer removed a few years ago. Do I need to come in more often for exams?
So if the skin cancer has been diagnosed within the first 2 years, we usually say you need to at least have every 6 months. If it's much longer, say if it's 5+ years out and you haven't had any kind of sun damage areas or pre-cancer or skin cancers, then it is reasonable to do yearly skin cancers. If you've had melanoma that is much more frequent, you're probably coming in every 3 months for a while.
A lot of people our age is, I can't believe we went to those 10 minutes. Right? But once you do find one, it's also reassuring too. You find it's quick and easy to get it removed. And then it's nice to have that come in at least twice a year and get that reassurance until you get the clean bill of health and you can wait a year. But I haven't quite got there yet. The next two actually I want to take because I have the answers to these. These do with scheduling and insurance again. But how soon can I schedule them again? Exam. So I actually went and looked at next week's schedule just to see, and there was a couple cancellations for next week. So typically we're booking out a few weeks. There's a few next week if you have time and you want to get in. please give our office a call in the morning. The phones turn on at 8 o'clock, 614-246-6900, and we can get you scheduled as soon as next week. When you do call in, we will take your insurance information so that we can verify that that is an insurance that we accept. But again, most major medical insurances are good to go. Otherwise, if next week isn't good, we can look at the next couple of weeks, but we can usually get you in pretty quick. And it's not a long appointment, 15, 30 minutes for that first initial check. So, and this was the same question, but I did want to say it again, is how do I know if you take my insurance? So again, surefire way, and this isn't just the Dermatology Center, this is any physician you go to. The best way is to always call your insurance carrier, the number in the back of your card, to verify your coverage. But you can call them, you can also call us, whichever is easiest. And as long as we can get a copy of that card, we can let you know it's covered. So again, as I saw a couple more coming in, I could see a couple more that were on the bottom of the screen as we were talking. So if we didn't get to your question, we absolutely will give you an email back. Also, don't forget, I will be emailing somebody tomorrow, whoever wins the $100 Med Spa gift card. And you should be all set. But again, thank you so much, Dr. Wetli. That was such a great presentation. Sorry for the little technical difficulty in the beginning. I apologize. But thank you so much. Have a great evening. Please don't hesitate to call. I'll be emailing everybody a copy of this presentation. So either email me back or give your office a call. Thanks so much. Have a great night.